So let's talk a little bit about this day of surgery. I know it can be anxiety-provoking coming in. This is a first for you, but it's not a first for us. We're very confident and comfortable bringing you through this journey on this day. So you can plan to be here, depending upon what you're having done, anywhere from about 2 to probably 3 hours that day. That involves getting you ready for the surgical procedure, having that, and then staying usually about 20 to 30 minutes post-operatively. So as we get you ready, my team will go through all their required items. We'll be starting some of your anesthesia. Our anesthesia typically is done with oral sedation only. We find our patients do best with that. It is safe and it is effective. It also allows you to breathe on your own and of course minimize the need for an IV, which can also cause a little bit of anxiety. If I need to mark you, I will come in and do that into your own individualized exam room. I'll get you marked of where I'm going to have my surgical incisions placed, and I say it's the roadmap to success. Next, we'll come gather you from your room and we'll bring you back to the procedure room where we'll make sure that you're laid down and comfortable so that your back, knees, neck all feel in a good spot. We will then inject some numbing around the area that we're going to work. I always say numbing is as numbing does. It works, but it does have a quick sting and a burn when we're going to place that around the eyes. It goes away very fast though. Not the effect, but the sting and the burn. We'll do that, then we will prep the face and of course around the eyes and get sterile drapes placed on. We'll perform the procedure that we have planned for you, and then post-operatively we'll bring you to the post-operative area where you'll sit for about 20 to 30 minutes with some ice compresses over your incisions and your eyes to help minimize some swelling and bruising. From there on, you're able to go home. We recommend frequent icing once you get home. This is all in your post-operative instructions to help minimize bruising and swelling as much as we can. My last bit of advice, the first day after surgery is always going to be the most interesting. Not necessarily uncomfortable, but interesting due to that bruising and swelling, and every day after that just gets better and better. Depending upon what other elective options you may have had, such as lower eyelids, lasers, etc., we may actually have you come back for another visit, because I do like to watch you a little bit more closely and make sure that everything is absolutely healing to our desire.